Welcome back to Mom in Mind. I'm your host, Dr. Kat. I'm really glad you're joining us for this episode today. I am joined by Kayleigh Summers, who is a licensed therapist, perinatal mental health certified, writer, content expert in perinatal trauma, and someone who went through her own experience of a really difficult birth trauma. So I want to give out a sensitivity notice at the top of this episode today. If you are somebody who is currently dealing with processing a birth trauma, or you would have a particular sensitivity to hearing about a life-threatening condition during birth, after birth, then please do just take a beat, think for yourself if this is an episode you'd like to tune into today. And if not for today, then know that it is always here for you to listen to whenever you're ready. Kayleigh is talking about her lived experience as an amniotic fluid embolism survivor and the work that she now does to support other people who've experienced birth trauma. Kayleigh has also created thriving support communities through Instagram and TikTok, as well as her podcast, Birth Trauma Mama, where she provides connection, storytelling, resources, and support to those who are experiencing birth trauma. We'll get into Kayleigh's story today, and also she's going to be talking about the subjectivity of birth trauma and having trauma-informed care and some really compassionate perspectives that hopefully, if you're somebody who's dealing with birth trauma or supporting others who've experienced birth trauma, that you can hear and listen to what Kayleigh is talking about today to help you through your own process or people that you're supporting through their process. All right, let's meet Kayleigh. Welcome, Kayleigh. Thank you so much for being here.
Thank you so much for having me.
So, we're talking about birth trauma today.
Yes.
And I would love to start with your experience and your story and what you've been through. And I know you're helping a lot of other people understand their experience through the work that you do. So we'll get into that a little bit later. But
Yeah.
yeah, just for us, start wherever you'd like to start with a bit of your story.
Sure. Thank you. I would love to. So I had a really typical first pregnancy. I was really large, as I like to say. That was like the one thing, but I was a first time mom. So I've never been pregnant before. But that was really the only thing that I was concerned about is how big my baby was going to be.
Hmm.
And then at 40 weeks and 2 days, I went in for just a typical appointment. And at the beginning and the end of the appointment, I had high blood pressure readings. And instead of it going down over the course of the appointment, it had gone up. And so because I was already past my due date, they went ahead and sent me to triage to be checked out, just in case, any preeclampsia, gestational hypertension. They're not really messing around with that after 40 weeks. So when I went in, I made the call with my medical team with what I feel was pretty significantly good informed consent to move forward with an induction of labor based on both the gestational hypertension as well as my concern about how large my child was. So I had a very long, slow induction process that I won't bore anyone with, but it was about 2.5 days. And on the third day, I woke up and was 7 centimeters. And then by noon, I was finally 10 centimeters. And so my OB came in and she said, "Get excited. You finally did it. Like, you're finally 10 centimeters. You're going to meet your baby." And a quick caveat that I don't remember any of this. And so my last memory is actually from the Friday before when I was getting my nails done. And then this appointment at my office was on that next Monday. So I don't remember that appointment. I don't remember going in for my induction. I don't remember the 2.5 days of induction. But this was all pieced together through my medical records, text messages, and obviously my family and my medical team. So my OB was very excited for me. I was apparently exhausted, but excited. And she left to go kind of get ready for me to deliver. And it was my husband and my nurse in the room at the time. And I turned to my nurse and I said, "I'm not feeling well." And she said, "Okay, that is pretty normal, pretty typical for transition. I'll get you a bag to be sick in." And I said, "No, something is very wrong." And when I said that, she glanced to look at my vitals. And at that point, they were all fine. But I immediately started screaming that something was wrong with my heart. And seconds later, I went into cardiopulmonary arrest. So my heart stopped and I stopped breathing.
Can I
Yeah,
ask you specifically
please.
what were, maybe this is hard because you said you don't quite remember, but
I have
how,
lots of
like,
details. Yeah.
okay. What were you feeling that you
Mm.
knew something was wrong?
That is one detail I don't have because I was
Uh-huh.
not inside my body. Like, I don't remember
Yeah.
being inside my body.
Yeah.
I have heard from others who have had a similar feeling. So it's called impending doom, and it is actually a medical symptom.
Mm.
So if you ask doctors, nurses, they have probably had maybe one or maybe zero, but they've heard of when a patient turns to you and looks you in the eyes and says, "I'm going to die."
Mm.
And then they do. So there's
Yeah.
some sort of physiologic reaction that happens in our body that we know that something really bad is happening
Mm.
before any monitors or anything picks it up.
Mhm.
So I'm guessing it was that feeling of like I'm gonna die.
Mhm. Okay, so um I'm just like having an awareness of what, like, people who are listening to this who have anxiety, and
Yes.
maybe panic attacks and have that the feeling. This sounds very different than that.
Thank you for bringing this up. It's a topic I talk about a lot when I talk about impending doom
Hmm.
because a lot of people will say, "No, I have panic attacks and I have impending doom." And I totally understand and agree with that. It is different.
Hmm.
And the way that other people have described it, which I have now taken on because I agree with this, is that it is not, it is like a for sure. Like it's not like an anxiety. It's not a
Hmm.
questioning. It's not a, oh my God, I'm so nervous. I'm so nervous it's going to
Hmm.
happen. It is like a, like almost peaceful, which sounds weird,
Hmm.
but like a, this is just a fact. Like
Got
I'm
it.
going to die right now. And that's hard for people to hear who have anxiety because I know they're going to say like, no, but I felt that way. I felt that it's like for sure going to happen. Um, and all I can say that this is a physiologic response that happens inside our body that is different than anxiety and it is different than panic.
Right. Right. So the some of the distinction that can be made is that, like, calmness that you described, or like a knowing,
And it's the
like a
knowing.
fact.
I
Uh-huh.
don't, yeah. And again, as someone who totally experiences anxiety, I know that's hard to hear because it's
Yeah.
very difficult to distinguish, but it is a just true to your bones knowing
Hmm.
that is different feeling than anxiety or panic.
Hmm. Okay. Thank you
Yeah.
for expanding on that. As much as I mean, from your own experience, I hear that it's hard to, but knowing it from
Yeah.
other people's, and all the people that you've talked to. Um, okay. All right. So you say that to the nurse, and then what
Yes.
happens?
A code blue is called for my room, and everyone comes rushing in. They push my husband to the back, and they make the decision to take me out to the OR. We do have an OR that is on the unit, and so it was right across the hall. They were able to get me into that OR, and they were able to deliver my son while they were doing CPR on me. And they had him delivered within 6 minutes of the code call, which is
That's
incredible,
incredibly fast.
incredibly fast.
So you already had an epidural, or
Yes, but even if I hadn't, they would have just, because I wasn't technically alive, they probably would have just gone for it.
okay. So again, just to like back up just for just a second.
Hmm.
So the the time from when you say, what were your words? Um,
Something is yeah, something is wrong. I don't feel right. Something's wrong with my heart.
Something's wrong with your heart. At that point, that's when your heart stopped.
Yep.
Uh, so from the time you said that, it was like the monitor didn't show anything, and then, like, you felt something. It wasn't showing up on the monitor, and then something happened.
Yes,
That
and then it
happened,
showed up on the monitor,
like,
obviously.
immediately. Right, right, right.
Yeah.
Okay. So, from that time to the time that your son came out was 6 minutes.
6 minutes.
Okay. So they're working on you, getting him out.
Yeah.
You said you were not alive.
I was not alive when my son was born.
Code blue was called. That's when, like, medically, technically, you were not alive at that point.
Yes.
And then after, okay, thank you for walking me through that.
Yeah.
So then at minute 6,
Mhm.
your son was born. Where was your husband in all of this?
In my room, in my L&D room.
Freaking
So
out.
yeah.
Right.
Yeah.
Absolutely. Okay.
So they did send 2 nurse managers in to sit with him, but yes, he was beside himself.
Of course.
And so my son was delivered, and because they got him out in 6 minutes, he did really well. He did need to be resuscitated, but once he was resuscitated, he did quite well. My OB will tell you that it is the heaviest baby she has ever delivered, not only because he was 10-14, but also because he had no muscle tone when he was born, because he needed to be resuscitated, making him
Oh,
feel a
like,
lot heavier than a baby who has tone. Yeah.
right. 10, 14. Okay, so your concerns about the size of your baby were real.
Yes. I felt very validated eventually when I found out.
Wow.
Yeah, so he was born and resuscitated. CPR had continued on me until the end of the C-section. As I was being sewn up, my OB would have to ask them to pause really quickly so she could put a stitch in and resume and pause and resume. And towards the end of that, they did get ROSC, which is resuscitation. So I was brought back in a sense. And
This
my
is well
OB,
after 6 minutes, though.
yeah, about, I think it was like 14, between 12 and 14 minutes.
So how do they, medically, how do they
hmm
determine how long you were essentially dead?
So because they're doing the hope is high quality CPR,
Okay.
they're circulating your blood for you.
Mm-hmm.
So the hope is that it's
Mm.
high quality enough that you're not going to have any cognitive impacts or things like that. But there's always, of course, a risk. My
Right.
team did a great job switching off every 2 minutes so
Mm.
that no one was getting tired. And it was that, again, high quality ACLS that we need to see in these situations.
Amazing.
Yeah.
Okay, so at what you said, 12 minutes, 14 minutes?
Yeah, around there, I was resuscitated. And this is when my OBGYN assumed I was having an amniotic fluid embolism, which is an incredibly rare obstetric complication that is unfortunately, it's unpredictable, unpreventable, and often fatal. So we don't know who it's going to happen to. We don't know when it's going to happen, and we don't have any treatment for it. So the best we can do is provide supportive measures to try to get the patient through and survive.
Um, so there, in terms of like risk factors, then there are none.
There really aren't. So the AFE Foundation will talk about a few, but the research is so spotty because this is such a rare complication and it is a diagnosis of exclusion.
Got it.
We don't have a test that tells us that you had an AFE or not. And so it makes research a little muddy, but
Mhm.
there are certain things that can increase the risk. Again, some research says no, some research says yes.
Mhm.
So we're still waiting to kind of have a little bit more evidence to be able to share. But I didn't have any of like polyhydramnios, which is like an excess amount of amniotic fluid is a risk factor.
Mhm.
I don't know all of them off the top of my head, and I don't want to misspeak.
Sure.
But there are a few others again that are some research says yes, some research says not so much.
Mhm.
But so with AFE, there's typically 2 phases, which is that kind of cardiorespiratory failure, and then DIC. So DIC is disseminated intravascular coagulopathy. It is essentially when your body throws mini clots everywhere,
Mm.
consumes all of your clotting factors, and then you bleed out
Mhm.
excessively.
Mhm.
Um, and so the reason that I mentioned that my OBGYN assumed I was having an AFE is because she prophylactically put in a Bakri balloon into my uterus, knowing that I was probably going to go into DIC, and a lot of the bleeding is going to come from the uterus at that point.
Mm.
And she also ordered a massive transfusion protocol, knowing again that likely I was going to be bleeding out. And
Within
so,
these minutes.
yes, yeah,
Can I ask a side question?
yeah.
I assume that the training is that they know they can tell, the OBs can, like, or have training,
Yep.
and will be able to know these signs. Um, Sometimes being able to get to everything in time, and sometimes not if things progress quickly.
Yep.
Sorry. It sounds like, I mean, your OB was on top of it.
She was. The entire team in the OR that day was on top of it.
Right.
AFE is one of those situations where everything has to be done absolutely perfectly.
Mm-hmm.
And even if it's done absolutely perfectly, someone might still die because we just don't know how their body is going to react.
Right. Okay. Thank you for
Yeah.
like my side questions. I'm both
Yeah.
kind of, um, like, the people who are listening are interested to know what happened to you, what you went through, and also, rightly so. These are things that are difficult for people to hear, and
Yep.
so, and anywhere in the process, as you already know, um, where any kind of knowledge or information or education can come in, people feel a little bit, better, maybe knowing that, people are really trained in this and can catch it.
Yes. Yeah. And I think people ask me all the time, like, what do I do with this information? This is terrifying.
Mm,
Like, now what am I supposed to do? And ask you, ask your OB,
mhm,
what is their protocol
mhm,
if there is a massive hemorrhage, if there is an amniotic fluid embolism, what do they do?
mhm.
And if your OB says, oh, you don't have to worry about that, go ahead and say, hey, I understand you're trying to reassure me, and I really do appreciate that, but it's actually more reassuring for me to understand what the protocols are that are in place than for you to kind of placate me.
Mhm.
Um,
Nice.
so yeah, but so
Okay, good.
anyway, yeah, so I'll kind of
Yeah, go back to your
breeze
story.
through the rest. Yeah. So I did go into DIC. I had a profound hemorrhage. I needed 143 units of blood product by the end of this ordeal, which is replacing my entire blood volume more than 10 times.
Mm,
And so this point, I actually ended up going into cardiac arrest again due to blood loss.
mm,
And so CPR had to be reinitiated again. And I recently interviewed my OB on my podcast, actually. She's a
nice.
wonderful human. And she said this was the moment where kind of like the rest of the OR started to prepare her for the fact that I wasn't going to survive.
Mm,
And she actually went out to my family at that point and said, we can't stop the bleeding. We're doing everything that we can, but we need you to pray. Which for me, from a doctor, is just like a very profound statement.
for sure.
Um, yeah. Um, and so she went back in and they were able to resuscitate me, but recognized that they were going to really need a higher level of care if I was going to survive. And so they called over to a larger medical center to get ECMO transported in. So ECMO is the highest form of life support, essentially takes all of your blood outside of your body, oxygenates it, and puts it back in.
Mhm,
There's a kind of lung version, which is called VV ECMO, and then a heart lung version, which does the job of both your heart and lungs, called VA ECMO. So I needed to be put on VA ECMO for both my heart and my lungs.
mhm,
So they ambulanced in ECMO and an entire ECMO team, and they were able to get me cannulated on ECMO. That helped just like stabilize me a bit. But the bleeding continued. So they did need to take me down, try to embolize my uterine arteries, which only worked a little bit. So they had to take me back and do a hysterectomy.
mhm,
And they also removed one of my ovaries because of all of the bleeding. And then they packed me and left me open because they knew that they would have to kind of continue to go back in over the next few days.
left
Um,
you open, meaning?
so they pack you and then they leave your incision open
Mhm,
and put what's called like a wound vac over
mhm.
top of it. They didn't want to have to keep putting my skin back together just to
Right.
reopen it. So yeah, exactly like that.
Mhm,
And then I was transferred about 9 hours after the initial cardiac arrest to the medical center that could maintain that ECMO circuit. And I unfortunately was not out of the woods yet because my heart wasn't recovering. Even though I was on ECMO, it was keeping me oxygenated and perfused. My heart wasn't recovering its ability to pump blood. And so, after lots of trials of medication, they kind of had a last ditch effort with an Impella, which is like this tiny little windmill like device that's a heart pump that they put up in through your femoral artery into your heart to help it kind of give it time to rest and recover so that hopefully you can keep your heart and not require a transplant. Or in my case, I wouldn't have been healthy enough for a transplant, so I wouldn't have survived. So thankfully that worked. And I was able to be decannulated from ECMO after about 2.5 days. I was extubated after 4 days. And I finally got to meet my son on the 5th day after his birth. Although I don't remember it, we have lots of beautiful videos and pictures of it.
Right. Um, right. So how part of what you said before, not remembering that, but also not remembering um, prior to any of this, is that part of the kind of aftermath of like memory loss specifically of what you went through, or is like medically, or is it trauma?
It's
Uh,
interesting. As a trauma therapist, I believe a majority of it is trauma.
mhm,
It's retrograde amnesia, and we would expect me to not remember like obviously like cardiac arrest and like some moments around there, but for it to go back like 5 or 6 days before that
mhm,
is a little bit odd. And actually, interestingly enough, when I first woke up when I was still in the ICU, our brains are crazy. I
mhm,
could not remember a single prenatal appointment. I couldn't remember what the office looked like. I couldn't remember ever having a prenatal appointment. I remembered other memories from that 9 months, but none of those. That did eventually come back.
mhm,
But when I first woke up, it was like my brain had tried to wipe like anything to do with like the medical side of pregnancy.
mhm. Right. Our brains are like a highly adept to protecting us
Yes,
from
yes, they
stuff.
are.
It's amazing.
Yeah, it is.
Um, okay, so I know we're kind of going through relatively quickly a
Yes,
long period of time and
yes,
a lot of medical, mental, emotional, like every kind of
yeah,
thing to go through. You went through, and
yeah,
everybody around you, like
yes,
your husband, your family, everybody,
yes, yes. It was very traumatic.
right? Um, so you said that, okay, so you got to meet your son. You don't remember
Yeah.
that. Um, from I guess the people were kind of documenting, taking pictures, videos, things like that. But basically looking at those pictures, what did it look like to you meeting your son for the first time was like?
That's a really good question. The video is really sad. It's really beautiful, but it's
Mhm,
really sad. I'm really out of it.
mhm,
People are kind of like holding up my arms to hold him. I don't really even have my eyes open for the most part. But there are some really beautiful moments of like my husband kissing my forehead, my mom like making sure that my hand was like touching my son, like holding my hand up to his skin so that I could
mhm,
actually touch him.
mhm,
And so there are some really beautiful parts. There are some really sad parts. I think for me, in that hospital stay. I don't remember that part, but then there are meetings that I remember after that with my son. And that whole ICU stay was a mix of being so grateful because everyone came in and told me about how I should be dead,
mhm,
and I wasn't.
mhm,
And so I remember like listening to music because I couldn't sleep in the ICU at all at like 3 a.m. and just hysterically crying because like my husband and I's wedding song came on and I couldn't believe I had like text messages that are like, I can't believe I get to just like do life again. It was like this very rose colored, like next to the just terror of being in the ICU and thinking I was going to die. So I wouldn't sleep.
right.
Um, and so I was in the ICU for another week, and that was it. So
Mm.
the plan was Kayleigh's going to be on ECMO for at least 2 weeks. She's going to be in the hospital for probably like a month or two. We'll transfer her from here down to the regular ICU, down to mother baby, and then to rehab. And then she'll eventually be able to go home. My body recovered much more quickly than that. So about a week after my AFE, I was transferred down to the regular step-down ICU. And then a week after that, I was transferred straight from that ICU to home. So exactly 14 days after his birth and my AFE, we went home. And we went home together because although he was healthy, my hospital was incredible and allowed him to board in the nursery for that entire 2 weeks so that they could bring him down for skin to skin twice a day.
That is amazing.
Like amazing. And we lived an hour away, more than an hour from that hospital. So it would have been, someone would have had to go home.
Right.
And instead, all my family could stay with me and also be with our baby. And obviously then me and Cal could be together.
That's incredible.
Mm-hmm. Trauma-informed care.
Right.
Yep.
It should be standard. Like,
yep.
No
should
question.
Be.
That's
Mm-hmm.
amazing.
Yeah.
I'm sad to say I don't hear about that level of care that often.
I do not either. I feel very lucky. And I know there are a lot of people that pushed very hard for it. Like there was a discharge date for my son, which was like a week and a half earlier than he actually discharged, and he was supposed to discharge then. And there were lots of advocating going on behind the scenes to make sure that he was able to stay.
That's amazing.
Yeah.
Okay, so even at home, it's not like you're 1,000% better and you're just home now. It's
Oh
a
no.
long road to recovery, right?
Yeah, I was very sick. So I had 4 more abdominal surgeries. So like every morning they would go in and do another abdominal surgery when I was still like intubated. And I had a bunch of chest tubes and things like that were just kind of annoying, honestly. And so when I got home, I was sleeping like 16 to 18 hours a day. And I wasn't taking care of my son at all. So that whole like gratitude piece, I thought we were going to like sail off into the sunset as a family of 3. I look at the picture. There's a picture that was taken of me and my husband in the car with our son in the back, which again, the fact that they allowed us to be able to leave that hospital together as a family of 3,
Mm-hmm.
I don't have words for that.
Right.
Because most people don't get that in our situation. So there's a picture of me crying, and I am crying like just tears of joy because I was like, we are going to sail off into the sunset.
Mm-hmm.
I was like, we are so lucky. I get a second chance at life. Like, this is incredible.
Mm-hmm.
So imagine my shock and devastation when the opposite truly happened, which is I was miserable. I couldn't take care of my own child. I didn't want to be a mom at that point, to be completely honest. I cried every day. I would walk downstairs. My family started to get worried about me because I would sleep forever, and then which is fine, my body was healing, but when I would walk down the stairs, they'd be like changing my son on the changing table downstairs, and I would just like walk right by and like not say anything and not interact with him. Because I wasn't bonded, and I was in so much pain, both physically and emotionally, that I just had no space for anyone else or to do anything else at that point. So definitely had reliving the ICU was a common one. I also obviously lost my ability to have any more kids. Mm-hmm. So sinking in the grief of like, I'll never get to experience an actual labor. I'll never get to experience meeting my baby for the first time. Like, I'll never get any of these experiences. So that grief was very heavy. And I didn't, even as a therapist at the time, PTSD wasn't something that was on my mind. Birth trauma wasn't something I had heard about. Mm-hmm. And so I was very confused by the symptoms. I felt angry, I felt sad, and then I felt so much guilt and shame.
Sure, right? If you
for
don't know
feeling
what's going on. Oh.
Yeah, for feeling angry and sad because there are other people who don't survive this. And I was here with my baby, and we were both healthy for all intents and purposes. And so how was I going to have any other feelings except for gratitude?
Man, I think that is like one of the ways that we do so much harm and disservice to new moms, new parents, that we don't know inherently that it's okay to have both. That
Yep.
it's going to be both. It's going to be a mixed bag. One
Yeah.
doesn't cancel the other. They can both coexist,
Yeah.
and they do. Um,
Absolutely.
Man, I can't wait for that to not happen anymore.
I know. We're getting there, I think.
I hope so. I
Yeah.
hope so. Right. So, when did you figure out what was going on? How did you figure out what was going on?
So I am very privileged in both in a lot of things, but where I live and also the amount of support that I had. So I am only, at that time, I was only like 45 minutes away from Karen Kleinman's Postpartum Stress Center. And as a therapist, I got a lot of referrals being like, you should go there. And I
Mm,
was like, okay. And so I did, and I had the most fantastic therapist in the entire world.
mm.
And she 3 years later, when we were done working together, she had told me that when I first called that first week, I called the week I was out of the hospital because I was
Oh,
like, even though
right.
I just know this is going to mess me up. So
Sure.
I was like Oprah. I was like, everyone's getting therapy. You're getting therapy. The whole
Right.
family's getting therapy.
Right.
So when I called, she said that she's like, okay, how is like 2 weeks? And I said, nope, can't wait 2 weeks. Need to be in there like now. And I don't remember that. And I'm a bit of a people pleaser. So I found it like fascinating that I was like, no, you will give me help and you'll give me right now. And she did. She saw me a week later and we met for 3 years. And so she really helped me better understand my feelings around it and allowed that space for me to really come as I was
Mhm.
without having to drown everything in gratitude and toxic positivity.
Great. Right. Because that honestly, it prolongs everything.
It did for me. Yeah,
Oh,
for sure.
man. Wow. So, yeah, that is fantastic that people knew where to send you and that was
Yes.
available and so close. And, man, I'm so glad that you had all of that to help. Um, and I also want to understand what things are like for you, meaning, are there still things that you are coping and dealing with, even though you've had great help?
Absolutely. 1000%. So this week is actually, when we're recording, is actually my son's birthday week. So he turns 5, which is crazy, on Wednesday. And I still get hit with emotions every birthday. The birthdays have gotten easier as I have gotten treatment and as time passes, and I really make space for all of my feelings around his birthday. I highly recommend that. It has gotten easier to celebrate the birthday, but that's one that always gets me. And the other one is actually a lot around the choice being taken away to have more children for me. That's been a long lasting one that I really couldn't touch for probably like the first year or two.
Mm-hmm.
Um, and I get griefy about that all the time.
Sure.
There's that is one that I still get triggered by when people will ask me about having more kids, or I don't know, whatever it is, talk about like the negatives of having an only child and how they're going to be ruined when they grow up, which I don't believe in.
Why do we say this to
I
people? It's
know, I
horrible.
know, I know. So, or even someone saying like, and I will jokingly say this stuff, but when other people say it, you know how it is, like,
Hmm.
oh, you can tell he's an only child. I'm like, ugh, can you not?
Yeah.
I feel crushed. So
Yeah.
yeah, so healing is so not linear as we know, but I talk a lot in my space about all of these feelings, and I think a lot of people expect that, like, oh, since I talk about this and I'm 5 years out, that I maybe don't get activated by things or my healing journey is over. I was saying how I had met with that therapist for 3 years and we kind of parted ways because I like graduated, if you will,
Hmm.
as we like to say. I was holding on me, checking in
Uh-huh.
once a month as we do with clients when they're
Right.
clearly good to go. But I recently started with a different therapist because it's not perinatal specific per se. And it's about how, all of these things are all interconnected, right? So doing some EMDR and IFS with actually a male therapist, which is not something I ever thought that I would do.
Nice.
So my healing continues, and it always will. And at each stage, I will continually be so grateful to get to witness these moments, to be alive, to witness these moments with my son,
Mm-hmm.
and be pretty sad that these are the only chances that I will ever get with my child.
Mm-hmm. Yeah. I mean, just being able to get to a place where you can hold both, even if you don't necessarily want both of those
Such a
feelings.
good way to put it. Yes.
um,
Yeah,
it's hard. Um,
it
it's
is.
hard. So in this, thank you, by the way, for just stating that healing is continuous,
Yeah.
essentially. Like you can do an amazing piece of work with one therapist and then go to a different therapist for a different
Yep.
thing. But also that like it's not like you're just done with something. It
No.
was a massive part of your life, and it changed your life in really significant ways. So you can't just like be like, okay, well, all done with that now.
No.
Especially with trauma, you kind of don't know when it's going to pop up all the time. Sometimes you just like turn around the corner and like, oh, then now I got to deal with that. But in your process, when was it clear to you that you wanted to help other people understand their birth trauma?
Yeah, I would say around the 6 month mark, I was in no way like ready to do any. I'll just say I wanted to talk about it.
Mm,
I wanted people to know that this was a thing because all I saw across my feed for the 9 months I prepared to give birth and the 6 months after were these like beautiful, wonderful, picturesque births, which we love. Like that's the goal. I want that for people.
mhm,
But there was not a lot out there about when things don't go right. And I learned so much in those early years of sharing. I learned so much more about the subjectivity of birth trauma, that birth trauma is, oh my gosh, an entire spectrum, and it is so much less. While the event itself will always be so, so important to those of us who have experienced it, it's so much less about the event itself and so much more about the way that our nervous system processes that event. And
mhm,
that will look different for everyone depending on their past experiences, depending on the way that they just perceive and interpret and feel in
mhm,
their birth environment, because there's so much vulnerability when we are giving birth. And so it was really, I've learned just as much as, I've been able to help support. I've been just as supported by the community. So 6 months is when I started talking and sharing our story and just about birth trauma in general.
mhm,
And then I was pretty, I don't know if cautious is the right word, but I felt very strongly about waiting to work with this population clinically
mhm,
until I felt very steady on my feet. Not meaning that I won't have healing to do, I always do, but I didn't open my private practice specializing in perinatal trauma until 3 years after
mhm,
my son was born.
mhm. Um, yeah, that makes a lot of sense. I think especially because that is important for so many reasons that you listened to that, for yourself. Um, because like being a therapist who's gone through something like you have and working with other people who are going through things, you can definitely still support folks even though you might be still processing some of your own trauma.
Absolutely.
But the like it that is actually something quite amazing to me that I love about therapists that are good at their job is to be able to like be there, just
Yeah.
be there with the person that they're helping, and even if they have stuff coming up, to know that that's their stuff and
Yep.
like go deal with it with their own therapist or somewhere else. It's an
Yes.
amazing like the brain is awesome.
It is.
So when you're trained and to be able to do that in a lot of ways. Um, uh, but if you know already that you have a certain level of vulnerability that will impact you more than is good for you, then
Yeah.
sure, hold off.
Yeah. Yeah, definitely. No, I agree. I think it's incredible what therapists can do. And I am glad that I listened to that intuition because it was actually less about other people's birth experiences because I felt like I could really take those in pretty well as I had in my social media community. But working as a therapist now in this space, I recognize that the things that are harder are around people talking about like their future choices for
Mm-hmm.
children and like the things that for me, like I'm so glad that I worked through a lot of that stuff to
Right.
be able to sit in these spaces and talk to people about one of my favorite topics is pregnancy after birth trauma.
Mm-hmm.
And it feels very healing to be able to help people on a journey that I will not be able to have.
Mm.
But to be able to hold those two things at the same time took years, for sure.
Yeah, 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 yeah. So the work that you're doing now, I mean, outside of your professional therapist work, your social media, your podcast, and all of that, obviously has a massive impact on people. What are the things that you are, some of the messages, like you have already touched on some that you're really wanting to get out to people, but what are you hearing from people who are seeing your post or listening to the podcast?
I think one of the most important things that sometimes I don't maybe give enough credence to or enough credit to is the healing aspect of finding a community that helps you feel seen and validated in your experience.
Mm-hmm.
I'm always talking about like you gotta get into therapy, like you gotta do the EMDR, like reprocess the trauma, and all those things are so important, and that's why I talk about them so much. And there is such a healing all on its own quality to having a community where you feel validated because so much of birth trauma is the invalidation of it, right? We have the traumatic event, and sometimes the invalidation of that traumatic event is worse than the trauma itself. And that continues, of course, to what's the word? Exacerbate
Mm-hmm.
continues to exacerbate the trauma symptoms and just the overall bad feeling. So reminding people to like find their community. I will say like find a birth trauma buddy that you can text when someone puts up their beautiful pregnancy announcement that is like not on them, that you feel all of the feelings. You're allowed to feel jealous, angry, sad. All of that is a valid reaction given what you've experienced.
Mm-hmm.
And we are asked to mask that all the time for good reason. We shouldn't be like flipping out on people because they're getting to have something that we can't, but we
Mm-hmm.
also get to have those feelings. And so having a person that you can text and be like, must be nice that Mary over here gets to just like get pregnant by accident or
Mm-hmm.
whatever it is, like, yeah, it's like we need a place to be able to vent that, knowing that it's our stuff that we're carrying,
Mm-hmm.
rather than having to bottle that up all the time. And so I think that's that community piece as well that's so important.
Um, yeah, absolutely. Also, I mean, there's so much in there, so many reasons it could be validating, but and I wonder for you and people that you
Yeah.
hear from, when you're like quote unquote fine, that's when people expect you to be fine. Um,
Yes.
and there's so many ways in which to use your word to like be invalidated by others. Um, where yeah, okay, maybe you're back to doing your day to day, but internally there's still a healing process, and it can be
Yes.
rather long. You know, for it obviously varies depending on the trauma and the person and the whatever, all the factors. Um, but that for that reason, if for no other reason, to have a community that says like, yeah, it's okay to not be okay, even if you're back to day to life.
Yeah. For a lot of birth trauma survivors, I think it's hard. For me, it was to physically heal and not have my emotional healing match that,
Hmm.
because everyone expected me to be over it, to be moved on, to have this be like a sad chapter in an otherwise great story.
Hmm.
And when I didn't feel that way, it was really hard to like exist, just to like walk around and exist without people knowing. It's like I say this all the time. You like walk around and exist, and you want to be like, I just had this horrific experience during birth. Like I want to wear a sign. That's how I felt like that first year.
Right,
Like
right.
And we will get a lot of people who be like, that's so attention seeking. Like you need so much attention. And I push back on that a lot because what
Yeah.
people are looking for is validation. They want to be seen for what they have experienced, which for a lot of people in my community is the most horrific day of their life on what should have been one of the most joyful and best days of their life.
Mm-hmm. Absolutely. I mean, it sounds like relatively simple, but the getting validation should be the easiest thing to give.
Yes,
I
it
don't know why
is.
it's so hard. Just
I know.
that's their
Yeah,
experience. That, anyways, again,
I know.
someday we'll get
Someday.
there. But it's incredibly powerful. And I mean, across your platform and the work that you do and what you talk about, that's like a lot of what you're giving is validation and speaking to things that maybe people haven't yet spoken about themselves and giving permission to feel, even if they never talk about it to somebody else, that there's some part within their experience that they can validate because of what you're putting out there. It's just beautiful.
Thank you. Yeah, if there's one thing that I want to help take away, probably sounds like a strong word, but like take away from people is the secondary feelings that come in. So, like when we feel angry, sad, jealous, whatever it is, and then we judge
Mhm.
those feelings. I want to take away the judgment. I want to
Totally.
show people that these feelings suck to sit with, don't get me wrong, and you also deserve the space to sit with them.
Hmm.
Because if you don't, then we can't actually heal. We can't do the work and everyone deserves that.
Absolutely. Well, Kayleigh, thank you so much for sharing all of this, sharing your story and the work that you're doing to help other people.
Thank you so much for having me and for all of the work that you do. I feel like you've been one of the pioneers in this space and you have paved the way for us to
Thank
be
you.
able to be here sharing on social media and podcasting and all of that. So I'm so grateful for your work.
Thank you. It was great to have you.
Thanks.
Please find Kayleigh's podcast, Birth Trauma Mama, wherever you listen to podcasts. You can also go to the website, birthtraumamama.com, where you can find links and connections to her social media and podcast. Please share this episode with anybody who you know have been through a similar scenario, who might need to hear the supportive words that Kayleigh offers, who might need to understand the ways in which they're not alone, or they could use the support of a community like the one that Kayleigh is offering. And make sure that you're following the Mom and Mind podcast, especially if you're a new listener. Go to your favorite podcast platform and hit follow or subscribe so that you can get each episode downloaded directly to you as soon as they come out. 6 episodes per month, focused on perinatal mental health and some of the stuff that happens during the therapy sessions for people dealing with perinatal mental health. Thank you so much for being with us today. Until next time.